Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now we have synthetic gonadotropin releasing hormone. In synthetic gonadotropin releasing hormones have been manufactured. Gonadotropin releasing hormone agonists and gonadotropin releasing hormone antagonists have been developed. Synthetic gonadotropin releasing hormone agonists include leuprolide, nafarelin, and buserelin. These are not orally active because they have high first pass metabolism. These gonadotropin releasing hormone agonists can be given intramuscularly, subcutaneously, or intranasally. They can be given either in continuous manner or pulsatile manner. In a continuous manner, if they are given continuous manner initially for 1 to 3 weeks, and then it increases the luteinizing hormone and follicle stimulating hormone known as flare effect. Later, they will decrease the luteinizing hormone, follicle stimulating hormone, and estrogen levels, thus resulting in inactivation of the ovary. Whenever there is inactivation of the ovary, it causes decrease in estrogen, progesterone, and androgen. Uses of giving gonadotropin releasing hormone continuously. So gonadotropin releasing hormone is given continuously in the management of hyperestrogenic conditions like endometriosis, fibroid uterus, precocious puberty, and breast carcinoma. And they are also used continuously in the management of high androgenic conditions like prostate carcinoma and hirsutism. Second, if gonadotropin releasing hormone agonists are given in pulsatile manner, then they act like natural gonadotropin releasing hormones, and thus they increase the luteinizing hormone, follicle stimulating hormone, and estrogen effects, which leads to the stimulation of ovary. Uses of gonadotropin releasing hormone in pulsatile manner. In conditions where there is decreased estrogen like delayed puberty, Kallmann syndrome, and ovulation induction, in them we have to give gonadotropin releasing hormone agonists as pulsatile manner.
thank you and thank you for watching.